Welcome to Med Diaries YouTube channel. In this video we are going to talk about aortic stenosis. What do you mean by aortic stenosis? It is a chronic progressive disease that limits left ventricular outflow, leading to symptoms of chest pain, breathlessness, syncope and presyncope and fatigue. This includes calcific stenosis of a trileaflet aortic valve, which is the most common cause of aortic stenosis. Also, stenosis of a congenitally bicuspid valve, and is the most common form of congenital heart disease. Finally, rheumatic aortic stenosis, which is seen in rheumatic heart disease, and the aortic valve is affected in about 30 to 40% of cases. In addition to these causes, aortic stenosis can be seen in chronic kidney disease, Paget's disease of bone, and etc. Let's move on to symptoms of aortic stenosis. Usually there are no symptoms until aortic stenosis is moderately severe. That means you will have symptoms when your aortic orifice is reduced to 1/3 of its normal size. At this stage, exercise-induced syncope, angina, and dyspnea develop. So when symptoms occur, the prognosis will be poor, and on average, death occurs within 2 to 3 years if there has been no surgical intervention. It is very important to understand the signs of aortic stenosis. Here, pulse will be in sinus rhythm and you will have low volume, slow rising pulse. You will feel a systolic thrill in aortic area and apex will be not displaced. On auscultation you will have an ejection systolic murmur, which is best heard in aortic area, radiating to carotids with same intensity. Let's see how you would hear this murmur in patients during cardiovascular examination. Let's talk about investigations done in aortic stenosis here. We can do a chest X-ray and it usually reveals a relatively small heart with a prominent, dilated, ascending aorta. Also, if we do a ECG, we can see left ventricular hypertrophy and left atrial delay. In severe cases, left ventricular strain pattern is common. Usually we see sinus rhythm, but arrhythmias can be noted in some cases. In echocardiogram, we will have the thickened, calcified, and immobile aortic valve cusps with left ventricular hypertrophy. And cardiac catheterization, CMR, and cardiac CT are rarely needed. Finally, we're going to talk about management of aortic stenosis briefly. So, all symptomatic patients should have aortic valve replacement unless there is a contraindication. Because symptoms are a good index of severity of the condition. Transaortic valve implantation can be performed if the patient is not fit enough for a major surgery. And this is the end of the video. Thank you for watching this video. Subscribe to Med Diaries YouTube channel and click the bell icon to get the notification as soon as we uploaded a new video. Have a good day.